The Prime Minister is rapidly becoming an expert in how to hold a vaccine bottle at just the right angle for the cameras.
Prime Minister, would you be able to look at the vial?
His latest visit taking in today a vaccination centre in Cwmbran in Wales. Vaccinations are, of course, at the heart of the way out of this pandemic, but in the short term the question is how and when to get out of lockdown.
We'll be setting out what we can on Monday the 22nd about the way ahead, and it'll be based firmly on a cautious and prudent approach to coming out of lockdown in such a way as to be irreversible. We want to be going one way from now on.
There is thought now to be a plan being finalised in Downing Street for surge testing across England ahead of schools returning. But if data determines deadlines, then advice to the government is that infection levels need to be significantly lower, towards the last August mark of below 1,000 new infections a day. Currently, they are at about 10,000 a day. A cautious approach was also the line from scientific advisors at today's Science and Technology Committee.
Is there a level of R that is that gives you confidence that we can proceed with lockdowns?
I think the important thing is that we watch what's happening in the real world and do our best to make judgments, probably in real time, about is this going too fast now? Do we need to pause for a while before we take the next step?
Empty beds at the Royal Free Hospital in North London, waiting for healthy young volunteers to be injected with small amounts of COVID-19. It's the first ever human challenge trial for the virus and will start next month. I suppose the question is why?
There are still all sorts of things we don't understand about viral shedding and what happens in young people when they get infected, whether they are likely to be a major source of transmission and so on. But also in this project, we're going to be setting up a platform to be able to test vaccines. And we know that even the first generation of vaccines, which are extremely effective, we already know that there are issues with them. They aren't necessarily going to be able to get to all corners of the world, not necessarily going to be available to everybody. And as the virus mutates, they may not be as effective into the future. So we need to have a strategy for being able to very quickly test new vaccines as they come online.
If rearranging the chairs was the task that fell to Mr. Johnson this morning, cleaning up after the virus will take considerably longer. But each day does bring hope, at least, that we are coming closer to a better understanding of COVID-19. Well, I had been going to say that we are seeing a very different Boris Johnson, as we heard in that package, a more cautious Prime Minister, though there was that slip-up that we just saw of him earlier, making an O.J. Simpson joke as he struggled to put on a glove at the vaccine centre, referring, of course, to the murder trial of the former American football player. But that slip-up aside, what we have seen and have been seeing some time now are no more wild promises that the Prime Minister has to immediately row back on. Remember that one, we were going to have Christmas in England and then it was cancelled. This cautious approach too is also being taken by the scientists who advise the government, first of all, because the numbers of infections are still too high and the numbers of people in hospital are still too high and the infection rates are still taking between 2 and 3 weeks to halve. So maybe it will take another 2-3 months maybe to get to where the advisors will feel much more comfortable. And just to go back to what the Prime Minister said today as he visited that vaccination centre, they really would like this to be, as we all would, to be the last lockdown. And what we're being told is that it really is possible as long as it's handled properly. There is good test, track and isolate, and that we maintain the hand washing, masks and some degree of social distancing and self-isolating when need to.
Victoria MacDonald, and we'll have more on the vaccine rollout and who isn't getting the first dose later on in the programme.